Welcome. Today, we're taking a really profound look at, well, a diagnosis of modern America, but one that comes from a very unexpected place.
Yeah, it's not your usual policy paper.
Hmm.
We're diving into Timothy Snyder's book, Our Malady, Lessons in Liberty from a Hospital Diary.
And it's based on his own harrowing personal emergency. A historian suddenly finding his own body failing him.
Exactly. He's known mostly for his work on, tyranny, 20th century Europe, that sort of thing. And then boom, late 2019, early 2020, he gets hit with sudden, really brutal sepsis.
Right at that cusp of time, just before the pandemic really exploded globally.
And that personal vulnerability, that near-death experience becomes this incredibly powerful lens for him to look at the sickness in the American system itself.
He uses this word malaise right at the start. It's
Yeah.
key, isn't it?
It really is. He points out it's an old term, actually dates back to around the American Revolution. And back then, it meant two things at the same time. Illness, like physical sickness, and tyranny.
Illness and tyranny bound together.
Right.
Wow.
And that's the core of his argument. Snyder argues Americans are, and this is his phrase, ill in a way that costs us freedom and unfree in a way that costs us health.
He uses his own medical nightmare, the sheer chaos of it, to show how the U.S. medical system, maybe over decades, has shifted.
Shifted towards, profit, wealth extraction, oligarchy, he calls it, over actual patient well-being, over life itself.
Before we get into the systemic failures, let's talk about what he says actually saved him in the hospital, because it sets up his argument for a national recovery.
Right. He identifies these two really fierce emotional forces that kept him going.
Okay.
This is where he brings in that tension between being alone, solitude, and being connected, solidarity. The first force was just pure intense rage.
Rage. Against what?
Against dying, basically. Against the particular nothing of death, as he puts it. It was this visceral, immediate demand for his own unique existence to continue. Pure me, he calls it.
What a primal assertion of self. I exist. I matter.
Exactly. He even noted in his diary something like, the shadow of the solitary is the unique, the demand that I get to compose my own life, not just decompose because the system failed.
Okay, so that's the solitary force, but you said there were two.
Right. Because that rage, that defensive self, it wasn't enough on its own. We're not islands, right?
Yeah.
Humans need connection. So the second force was empathy.
Ah, so shifting outward.
Yeah, a gentler force, but just as powerful. It was this sudden, sharp realization that his life was deeply shared, especially thinking about his kids, his loved ones.
How'd he picture that?
He calls life with others an uneven floating conveyance, like a raft. And in that moment, facing death, he saw that if his plank, his part of the raft, just fell away, well, the whole structure gets shaken. His loss affects everyone else on it.
So empathy isn't just a feeling, it's like structural, necessary for survival.
That's exactly his point. The shared infrastructure we need.
Okay, that's a really powerful framework. So Snyder's saying we need both to be truly free. The rage of the individual affirming our worth, and the empathy of solidarity, keeping the collective raft afloat.
Precisely. We need that solitary torch, and we need the water of solidarity. Let's definitely hold on to that as we look at how things went so wrong for him personally.
Okay, so let's get into the actual timeline of his illness. It really does read like a masterclass in systemic neglect.
It's shocking, especially because, this is a globally recognized historian.
Yeah.
Someone aware of systems, of how things work or don't work. And yet,
It starts in Germany, right? December 2019.
yeah, Munich, December 3rd. Doctors there apparently overlook his appendicitis. He flies home, not realizing he's got a perforated appendix, basically a ticking time bomb inside him.
He has surgery back in Connecticut, but that's not the end of it.
Not even close. He's discharged the very next day. He notes the antibiotics seemed insufficient. And, crucially, scans already showed an infection starting in his liver. But the system, the American mechanical logic, was already pushing him out. Get the bed free.
And then that liver infection just gets missed again.
Yeah. He flies down to Florida, feeling much worse, gets admitted to a hospital there. They run tests. But again, discharged the next day. No real diagnosis for the severe tingling, the awful headache he was having.
So the system sees symptoms but doesn't connect the dots.
Exactly. By the time he gets back to New Haven, Connecticut, that's December 29th, he's in full-blown sepsis. The liver infection wasn't just an infection anymore, it was a huge abscess. His description is chilling, the size of a baseball.
A baseball from overlooked appendicitis weeks earlier. And the scene he paints in that New Haven ER.
Oh, it's visceral. He's there for 17 hours. 17 agonizing hours, and he describes beds just lining the hallways.
A clear sign the system has no slack, no reserve.
None. It's that just-in-time model we'll talk more about. And here's a key failure point. He actually brought his records from the Florida hospital, printouts, even a CD, stuff that might have shown what was happening with his liver.
But they didn't look at them.
Ignored. Dismissively, he says. Doctors were not interested in outside data. He was basically told, we do things our own way here. Systemic arrogance, really.
And the care itself was chaotic.
Totally. He talks about doctors and nurses being constantly distracted, unable to finish a sentence. He even mentions a doctor being on a cell phone while performing an unnecessary spinal tap on him.
Unnecessary.
Yeah, because if they'd checked those Florida records or even just listened properly, they'd have known the problem wasn't spinal. It was this massive growing liver abscess. The distraction, the procedural momentum, it overrode actual diagnosis.
And as all this is happening, this personal medical crisis also becomes a window into wider social issues, specifically racism.
Right, and this really grounds the political critique in, well, painful reality. When he first gets to the ER, desperate, his friend comes to advocate for him. She's a black physician. She'd called ahead, pleaded for urgent care.
Did it help?
Zero effect, he says. And later, he actually overhears two nurses talking about her, kind of laughing, asking who was she. She said she was a doctor.
Wow. So her expertise was just dismissed.
Snyder concludes, pretty unequivocally, that racism directly harmed his chances then. His advocate's knowledge was discounted because of her race.
The whole environment sounds like a microcosm of the malady he's describing. Pain, poverty, prejudice.
Absolutely. He describes the sounds from beyond his little curtained-off area. There's a homeless man shouting obscenities, but also weirdly riffing on the built of Orion. There are police officers nearby, loudly using terms like unperson about African Americans they were processing.
Just raw chaos and dehumanization.
Yeah. The noise, the distraction, the racism, the dismissal of vital information. Snyder argues this is the illness. The system isn't just failing to treat disease, it's actively generating it.
And that's the leap he makes, from his personal hell to the national picture. He connects his experience to some really stark statistics.
Devastating stats. Even before COVID hit, by 2020, U.S. life expectancy had basically flatlined, even started declining in some groups. Americans were already living about 4 years less than people in similar wealthy countries.
Paying the most, getting the least in terms of lifespan.
Pretty much.
Yeah.
And the numbers on infant mortality are just horrifying, especially for black mothers.
Worse than many developing countries.
Yeah, he lists Albania, Kazakhstan, China, about 70 other countries where babies born to black women in the U.S. have a higher mortality rate. It's shocking.
And there's a generational aspect, too.
Definitely. Millennials are now projected to live shorter lives and spend more on healthcare than Gen X or the boomers before them.
So what's his conclusion from all this data?
It leads him to define the American system not primarily as healthcare, but as, quote, wealth transfer that incidentally involves some healthcare. The structure itself, he argues, is designed to squeeze profit from short, sick, and desperate lives. That's the malady.
Okay, so if the system is geared towards exploiting sickness, Snyder also points a finger at culture, specifically how we deal with pain, or rather, how we don't.
Right, he ties this back to his own upbringing. Ohio farms, a culture where you're expected to be tough, to not complain about physical suffering, stoicism, but maybe taken too far.
He gives personal examples, doesn't he?
Yeah, vividly. Breaking his wrist as a kid, age 8, and literally not making a sound until he saw the x-ray. Treating pain like it was some kind of personal failing. He talks about spraining ankles, breaking ribs later on, just toughing it out. Partly no insurance, sure, but mostly this ingrained. He calls it diffidence about pain.
And he connects that personal diffidence directly to why his own appendicitis got so bad. He ignored the signs too long.
Exactly. And he argues this vulnerability, this cultural pressure to silence pain, to not seek help, isn't just his story. It's shared by millions of Americans. And it makes them, well, vulnerable to exploitation by the system.
How so?
Well, if your main choices seem to be either suffer in silence or find a pill to numb it, the system has you trapped. That's the direct route, he argues, into the opioid crisis.
The choice between pain and pills, but without real human contact, without medical solidarity.
Precisely. That vacuum leads straight to addiction for so many. He talks about the pill mills near his grandparents' farms. Portsmouth, Ohio, ground zero. He cites this unbelievable statistic. 80,000 residents there were prescribed something like 10 million opioid doses in just 1 year.
10 million doses for 80,000 people. That just lays bare the logic, doesn't it? Suffering isn't just unfortunate, it's incredibly profitable.
Immensely profitable, reliably profitable. Dependency is a business model.
And this desperation, this pain, it doesn't just stay personal or economic, it becomes political fuel.
Hugely political. Snyder brings in some really striking data here. He shows that the level of opioid abuse in a county, the rates of addiction, despair, was actually the single best statistical predictor for which counties flipped to vote for Donald Trump in 2016.
Places like Scioto County in Ohio, key counties in Pennsylvania, votes driven by deep, unaddressed pain.
Yes. But here's the really cynical part, according to Snyder. The politicians who gain from this desperation then actively work against providing the kind of help these communities actually need.
How does that work?
He calls it pseudo-populism. It's a twisted kind of politics. They argue against things like public health initiatives or universal insurance things that could address the root causes of the pain and addiction. But at the same time, they flatter, particularly white working-class voters, telling them they're too proud and upstanding to need that kind of help.
Framing government assistance or universal care as somehow weak or a betrayal of self-reliance.
Exactly. Using flattery to deny care. Snyder's language is blunt here. He calls it sadism to manslaughter. He argues that opposing public health because you think it might help someone you deem undeserving is ultimately self-destructive.
His analogy is stark, like jumping off a cliff thinking someone else's body will cushion your fall.
Right. This culture of resentment, fueled by unaddressed pain, ends up undermining everyone's freedom, including the very people voting to perpetuate it.
But this idea, health is a basic right, it isn't some radical new thing, is it? Snyder points out the U.S. actually helped establish this internationally.
That's a crucial historical point he makes. After World War II, the U.S. was instrumental in drafting foundational agreements. The World Health Organization Constitution in 1946, for instance, which explicitly talks about the right to the highest attainable standard of health, and the Universal Declaration of Human Rights in 1948.
So we helped write the rules.
And then largely failed to follow them ourselves. The irony, he notes, is pretty stark. Look at Japan and Germany, nations whose post-war constitutions were heavily influenced by the U.S. They do have universal health rights. And guess what? Their populations live significantly longer, healthier lives than Americans.
They implemented the principles we championed. What about domestically? Does he see support for a right to health in the U.S. founding documents?
He argues it's implicitly there. Look at the Constitution's preamble. It talks about establishing justice, ensuring domestic tranquility, promoting the general welfare, securing liberty. These aren't just abstract ideals. They require certain material conditions.
And the Ninth Amendment.
Yeah, the one that says just because certain rights are listed doesn't mean other rights retained by the people don't exist. He connects all this straight back to Jefferson's famous line, life, liberty, and the pursuit of happiness.
You can't really pursue happiness if you're chronically ill or lack basic care.
That's the argument. Jefferson himself apparently said something like, without health, there's no happiness. So for Snyder, basic health isn't just a nice to have. It's the absolute prerequisite for any meaningful freedom.
Okay, so moving from the politics of pain, Snyder's next big lesson seems to shift focus entirely. It's about the future, about generations.
Yeah, and specifically about the cost of, as he puts it, doing it alone, especially when it comes to raising children. He uses this incredibly detailed comparison of the births of his own two kids.
One in Austria, one in the U.S.
Right. And the contrast is just night and day. It reveals these two totally different underlying logics.
Right.
One based on community and life, the other on profit and extraction.
Let's start with Austria. Vienna, 2009, 2010. What did that look like?
It sounded humane, rooted in solidarity. They paid a modest insurance premium, got excellent prenatal care, all tracked in this handy little mother-child passport. They even had subsidized birthing classes that were apparently fun, social, felt like being welcomed, supported.
And the actual hospital stay after the birth.
This is key. It was mandatory for 96 hours, 4 days. And this wasn't about billing or keeping a bed full. It was purely clinical.
To ensure the baby got a good start.
Exactly. And crucially, to help the mother establish breastfeeding, which can be really difficult. He describes nurses constantly coming around, helping with latching, positioning, just practical support. And when they left after 4 days, no forms, no complex bills, nothing.
Wow. What about fathers? Was there support for them?
That's another striking contrast. He mentions Austrian fathers he met, basically pitying him for the standard American parental leave, which at the time for him was maybe 1 semester paid. These Austrian guys were casually talking about their options up to 2 years of paid leave, which could be split between parents.
2 years?
Yeah. They apparently called the U.S. standard barbaric. And this wasn't just policy, it changed the culture. He describes seeing fathers pushing strollers everywhere, feeling like part of this infrastructure of solidarity. It was normal, expected.
Okay, so that's the solidarity model. Now contrast that with the second birth back in the US a couple of years later.
Total shift. He calls it mechanical logic. Because his wife turned 40 during the pregnancy, the system's algorithms flagged 40-plus
Which automatically triggered.
induction protocols.
Yeah.
The system saw her age as a risk factor, a liability, and wanted to manage it algorithmically. They had to actively fight the hospital just to let labor start naturally. It was a battle against the machine.
And once the baby arrived.
The clock started ticking immediately. Get them out, free up the bed, keep the revenue stream flowing. Urgency. Transaction.
Was there the same kind of nursing support for things like breastfeeding?
Almost none. It was so lacking that his wife was basically handed a photocopied diagram of breasts as the main instruction. And then, of course, came the discharge, accompanied by a mountain of bills and complex forms.
So care replaced by paperwork and pressure.
Pretty much. The whole experience felt defined by the system's needs, not the family's.
And he argues this high-pressure transactional approach fuels that American culture of hyper-individualized parenting, that feeling of being alone.
Absolutely. He tells this anecdote about being in a music class for toddlers back in New Haven. He noticed the parents seemed intensely focused on their own kid, but almost nervously avoided interaction with other parents or children.
Why? What was the explanation?
He finally asked one mother why everyone seemed so anxious if their kid wasn't right in front of them. And her answer just crystallizes the whole problem. She said, "I guess it's because we know that at the end of the day, we are doing this alone."
Wow. Doing it alone, that's the malady right there in parenting.
It is. The lesson being you can't achieve real freedom or stability in isolation, especially during those incredibly demanding early years. You need community. You need support.
Is there science behind this? Beyond the anecdotal?
Oh, yeah. Serious developmental science.
Yeah.
Those first 5 years of a child's life are absolutely critical for building the foundations of adult capacity. Things like resilience, recovering from disappointment, emotional regulation, delayed gratification, all the stuff you need to be a functional, free citizen in a complex society.
So freedom isn't just something you're born with. It needs to be nurtured early on.
Snyder puts it beautifully. He says freedom is essentially a loan. Children borrow intense and thoughtful attention and, importantly, supportive infrastructure from the adults around them. And then, ideally, they pay that loan forward to the next generation. That's how a free society sustains itself.
And if we fail to provide that attention, that infrastructure,
We break that generational contract. We undermine future freedom, which means the policy solutions aren't radical ideas, they're basic infrastructure needs.
like what?
Guaranteed substantial parental leave for both parents. Predictable work schedules so parents can actually plan. Paid sick days.
Yeah.
Affordable, high-quality public childcare. Things that are just considered normal, essential parts of a healthy society almost everywhere else.
It's striking how his hospitalization in late 2019 leads right into this next lesson, which is about the failure of knowledge, the truth crisis, just as the pandemic was starting in early 2020.
The timing is uncanny, isn't it? It highlights how a system already weakened by prioritizing profit over care and already suffering from a kind of informational decay was completely unprepared for what was coming.
He points to specific government actions or inactions even before COVID-19 was widely known.
Yes, and it's alarming. He details how public health infrastructure was actively being dismantled. Units within the National Security Council and Homeland Security, specifically designed to handle epidemics, had been disbanded.
Really? They got rid of the pandemic units.
Apparently so. And maybe even more critically, the last CDC officers stationed in China was recalled in July 2019, months before the Wuhan outbreak. On top of that, the CDC's budget had faced repeated proposed cuts. The warning systems are being switched off.
So an active preference for ignorance almost, creating this vacuum right when truth was most needed.
Which led directly to what Snyder calls the tyranny of low numbers. He argues that the president at the time actively preferred not knowing the true extent of the spread because low numbers looked better politically.
The infamous cruise ship example.
Right. The comment about wanting to keep infected Americans on the ship, off the coast, specifically because I like the numbers being where they are. I don't need to have the numbers double. It's the government explicitly choosing political image over accurate data and human life.
And the cost of that lost time, that stupefaction and mendacity, as Snyder calls it.
Catastrophic. He gives this stark comparison. By the end of February 2020, the entire U.S., a massive country, had tested only 352 people for the virus.
352.
Meanwhile, South Korea had tested 75,000. That failure of knowledge, that gap, had deadly consequences. By the end of May 2020, Snyder notes, just New Haven County in Connecticut, with less than 1 million people, had suffered 3 times more COVID deaths than the entire nation of South Korea.
Just staggering. And this vacuum of real information, it opens the door to scapegoating, doesn't it? That classic authoritarian.
Absolutely. It's an age-old pattern. When you don't have solid science and public health infrastructure explaining a disease, societies tend to fall back on blaming outsiders. Think medieval plague blamed on Jews, or syphilis blamed on whichever nationality you disliked at the time.
And the modern equivalent.
Blaming the Chinese virus, pushing conspiracy theories about bioweapons. Snyder argues this follows the authoritarian playbook. Deny reality, promise a miracle cure, attack the messengers, like reporters, and scapegoat foreigners or minorities. It deflects responsibility from leadership's failure to prepare.
He brings up Gandalf from Lord of the Rings here, doesn't he? As a counterexample.
Yeah, it's a neat analogy. Gandalf's role is often to be the bearer of bad news, the teller of unwelcome truths, trying to convince people of a real threat they don't want to see in order to build a coalition to fight it. If we starve ourselves of knowledge, we make ourselves vulnerable.
And a major way we're starving ourselves of knowledge, he argues, is the collapse of local journalism.
This is a huge point for him. He talks about news deserts, areas where local newspapers have folded, where there are no reporters on the ground asking tough questions, investigating local problems.
How does that connect to health crises like COVID or opioids?
Because without local reporters, these crises can spread silently. He gives examples from Kentucky unchecked environmental pollution, from strip mining, sewage dumping that harms communities, the opioid epidemic taking root without scrutiny, national news, or worse, social media driven by algorithms can't replace that local factual reporting.
So big data failed us in the pandemic.
Fundamentally, yes. Because the business model of big data, social media platforms, it's about keeping eyeballs glued to screens for advertising. It prioritizes engagement, often inflammatory engagement, over verifiable facts about what's happening in specific places to specific bodies. Like, who needs a test? Where is the outbreak? Big data wasn't built for that.
The vacuum gets filled with misinformation, ideology, conspiracy theories.
Exactly. Which is why he calls local reporters the heroes of our time. They provide the granular facts needed to push back against the national narratives, the propaganda. He argues that supporting independent local journalism is absolutely essential, not just for democracy, but for public health itself.
Because health depends on truth.
Utterly. The death of truth leads, quite literally, to the death of people.
Which brings us to Snyder's fourth big lesson, drawing directly from his hospital experience. The people actually providing the care, the doctors and nurses, they aren't really in charge.
And a terrible paradox, isn't it? They're the ones on the front lines, risking their lives, especially during something like COVID. Yet they have, as he puts it, very little say in what happens around them.
Who does have the say then?
The money. The financial oligopoly, he calls it. Private equity firms buying up hospitals and doctor practices. Giant insurance companies dictating terms. They control the hospital boards. They set the policies.
And the doctors and nurses become
Props and advertisements, is his phrase. Front men and women, their smiles masking the dysfunction of a system driven by competing corporate interests, not patient needs. He notes that during the 2020 bailouts, the financial players had a loud voice demanding support, while physicians and patients had almost none.
And this financial logic also dictates that awful just-in-time model for hospitals.
Yes, applying manufacturing efficiency logic brutally to healthcare. The goal is to run as close to full capacity as possible all the time to maximize profit. That means deliberately not having reserves of beds, equipment, or even staff.
So we're structurally guaranteed to be unprepared for any surge, any pandemic.
Exactly. When a crisis hits, it's labeled exceptional, an unforeseen event, and then money gets thrown around, but often not based on where doctors say it's needed, but to the sectors with the best lobbyists, the loudest political voices.
Let's talk about some specific examples he gives of how this profit over people logic plays out, leading to bad health outcomes.
Okay, well, consider the difference between primary care and surgery.
Right, basic checkups versus specialized operations.
Primary care, the regular doctor visits, preventative care, managing chronic conditions, that's arguably what matters most for long-term health. But it's not very profitable in the current system.
Yeah.
Specialized surgeries, procedures, much more lucrative.
And the result?
Predictable shortages in the less profitable but crucial areas. Not enough internists, not enough pediatricians, He even mentions geriatrics, care for the elderly, as a field that's actively shrinking just as the population ages, purely because the commercial logic doesn't favor it.
That's deeply concerning. What about surgical implants? He raises serious flags there, too.
Oh, big time. He describes the regulation around things like artificial hips, heart valves, mesh, etc., as shockingly lax in the US. There's often no comprehensive national registry tracking which devices are in which patients.
So if something goes wrong, it's hard to track.
Very hard. And the legal standards often don't force manufacturers to learn from failures effectively. Snyder makes this alarming claim, based on available evidence, that complications from poorly regulated implants might actually be one of the leading causes of death in the United States. But it's hidden and hugely profitable.
He also uses antibiotics as a clear example of market failure.
Yes, it perfectly illustrates how pure capitalist logic can work against health. The problem is bacteria evolves resistance, so a new antibiotic might only be effective for a limited time before bugs adapt.
Meaning the return on investment for the drug company is uncertain.
Exactly. Developing a new antibiotic costs billions. If it might become obsolete quickly, pharmaceutical companies are hesitant to invest. His chilling conclusion. If you apply pure capitalist logic to health, the bacteria win. The market won't solve that problem on its own.
Even the technology, the electronic health records, or EHRs are part of the problem.
He argues they are, because they're not primarily designed for patient care or clear communication between doctors. They're optimized for billing.
Billing and legal protection.
Right. Maximizing revenue, coding procedures correctly for insurance, create a defensible record.
Yeah.
Not necessarily for conveying subtle observations or, helping a nurse notice something critical. He uses his own improperly attached liver drain as an example. It caused him immense pain and risk, but went unnoticed for days, partly because check drain attachment wasn't on the standardized EHR checklist for the nurses.
A doctor literally told him the notes are mainly for billing.
Yeah, the tech serves the financial system, not the patient or the clinician, fundamentally.
So the final argument is that this whole system, built on this myth of efficiency, needs a fundamental overhaul.
Absolutely. The central lie, he says, is that our commercialized medicine is efficient or affordable. We pay a huge premium for the privilege of dying younger compared to other wealthy nations.
And the economic argument supports change, too.
Strongly. Letting people get sick, letting pandemics run wild, that crushes the economy. We saw with COVID trillions lost. Investing in health-supporting kids, focusing on prevention, empowering doctors that actually save vast amounts of money in the long run. It's not just morally right, it's economically smart.
He also connects the malady directly to rising inequality, the oligarchy.
Yeah, he points out how billionaire wealth soared during the pandemic while millions suffered. It starkly reveals how wealth is, in some ways, extracted from sick American bodies.
So what's the path to recovery? What are the pillars he lays out?
He sums it up with 4 key shifts. 1, we have to start regarding healthcare as a fundamental human right. 2, we need to take knowledge, both medical science and local, on the ground reporting seriously again. 3, we must make time institutionally for young children and their parents. And 4, we need to put doctors and medical professionals, not financiers, back in charge of the healthcare system.
And getting there means tackling the financial oligarchy head-on.
Yes. Antitrust action to break up massive hospital chains and insurance conglomerates. Debt forgiveness programs to get doctors into underserved rural and urban areas. And ultimately, he advocates for moving towards a single-payer system.
He even invokes Friedrich Hayek, a champion of free markets.
Right, pointing out that even Hayek strongly opposed oligopoly and believed civilized nations would naturally provide comprehensive social insurance, including health.
That really undercuts the argument that universal care is somehow anti-freedom.
It does. If we accept that our health is fundamentally interconnected, that we need that raft of solidarity, then the political arguments against ensuring everyone has access start to dissolve. As Snyder puts it right near the end. If we all cross the bridge to health together, the trolls cannot stop us.
In the epilogue, Snyder reflects on his own recovery. It's not a simple return to how things were before. He's permanently changed.
Yeah, he talks about the physical marks, the 9 surgical scars, the chronic tingling that remains in his limbs, things he physically can't do anymore, like drink coffee or tie a tie the way he used to. He's been altered by the experience.
And the implication is the country needs to be altered too. We can't just go back.
Exactly. That personal transformation needs to translate into a collective demand for systemic change. He learned the hard way to balance that solitary rage, the vital defense of his own unique self, with the absolute necessity of shared empathy, of solidarity. The core message of Our Malady really boils down to that final, unavoidable point he makes. To be free, we need our health, and for our health, we need one another.
It makes you think, if the founders really did aim for justice, tranquility, general welfare, as they wrote in the Constitution, what does it mean for us to actually claim that right to health, that right to knowledge today?
Yeah, how do we move beyond that isolating, often self-defeating rage
Mm.
and start building, demanding that infrastructure of solidarity that allows everyone to be healthy and therefore truly free?
Yeah,
Maybe that's the new American dream we need to be pursuing.
definitely food for thought.